This video is going to cover the placement of a magic screw. This screw is used to grab the quadrilateral plate of the acetabulum. We use it mostly in repair of elderly acetabular fractures. The starting position for the guide wire is centered about at the level of the greater trochanter. The trajectory is going to be a little bit from proximal to distal and then a little bit from lateral to medial. We typically use the iliac oblique and the AP view to place the guide wire. So here the surgeon has placed the guide wire into position. He's going to check it on the iliac oblique. And what you want to do is aim the guide wire so it's going a little bit from A to P, avoiding the acetabulum on the iliac oblique. On the AP view, you want to go from lateral to medial, and the goal is to grab the quadrilateral plate. So once you get the guide wire in a good position, you go ahead and start it, and you pass it through the lateral cortex on the AP view. And then when you get going a little bit, you check it again on the iliac oblique to make sure that you're still missing the acetabulum. On the AP view, it may look like you're hitting the acetabulum, but as long as you're clear of it on the iliac oblique and staying in the posterior column, you should be okay. These patients almost always have fairly osteopenic bone, so you have to be careful as you pass the guide wire through the medial cortex of the quadrilateral plate. If you pay attention as you're passing the guide wire, you can almost always feel as it pierces that quadrilateral plate. Once you get it in acceptable position, you widen the skin incision a little bit and pass a measuring stick over the guide wire and then measure the length. These are usually 45 or 50 length screws. Typically, you have to use screws with short threads because you don't have much bone to work with. Once the appropriate length is learned, the screw is placed over the guide wire in standard fashion. Again, the osteopenia is a problem, so you have to go slowly and pay attention to the grab that you get at the top of the quadrilateral plate. You have to be careful when you seat the screw so as not to strip it. You don't have much bone to work with, and so you have to watch it on fluoro, typically an AP view, and an inlet view is also useful so that you can see the quadrilateral plate as you pierce it with the threads of the screw.